Hi there, I'm Carolyn, Trichologist. I help people with hair loss, hair thinning and scalp conditions. And one of you reached out to me asking a question about traction alopecia. So we're going to take you through one of our cases. So I firstly said the most important thing with traction is stop the traction, and then you get a microscope and have a look at the area of traction to see the follicle status. Now, there's 3 different phases of traction alopecia, and this one we had actually had fibrous tissue developing, and we'd actually lost some follicles. So you can't say that you can regrow hair in that situation, but I think it's worthwhile of giving it a try, because we could see surrounding some of the other hairs were in this little vellus stage. So the question was, can we use a microneedle on traction alopecia? So you need the microscopic diagnosis to see whether it's worth your while. So the microneedle will channel through to get down to the cellular level, so we can try and connect it back together. But I find on its own, it's just a facilitator. So if you're going to use microneedle therapy, particularly in traction, you need to prepare the scalp, and you want to use some topical products to trigger some hair regrowth. So here is 4 months after we started. We can still see some follicles are opening, but we did start to fill the patch in as well. Now, it does take time. This traction had been there for over 10 years, so you're not going to get results overnight, but doing this type of combination therapy, you will actually start to fill in. In this case, we're actually improving all the hair that was around there as well. So I hope that answers your question. If you do have other topics, you can leave me a comment, or you can always email me info@absolique.com.au.